This is I'm sad to announce, our last of the 3 panels on current initiatives because they've been so fascinating. So if you would join us for this one. This is efforts incorporating additional behavioral levers. And joining us here on stage, we have Lori Cayley from the LA Sutherland Group. We have Elizabeth Pivonka from Produce for Better Health Foundation, and Colin Payne from New Mexico State University, and Tatiana Andreeva from the Rudd Center at Yale. And so, Lori, if you'd come right up. And remember, be thinking about the notes you want to give back to NCCOR when you leave. It's this button right there. Yeah. Ooh.
Well, good afternoon, everybody. It's great to see some of you are still here for the afternoon presentations. And I was going to say that I was going to thank you for inviting me, but actually you didn't invite me. You invited my colleague, Lisa Sutherland, who many of you know, and she couldn't be here today, so she asked me to come instead. And so I'm really excited to be here with you to be able to talk about a tale of 2 retail leaders. And what I want to do is really share my appreciation for the opportunity to be able to talk about Hannaford's Guiding Stars as well as Walmart's nutrition commitments. Walmart's been mentioned once or twice here today, I believe. But I did have the opportunity to be on the scientific advisory panel for the Guiding Stars for Hannaford with Dr. Lisa Sutherland and also Tracy Fox, who's here today. You'll hear from her a little bit later, but I don't think about this. And so I want to provide a little bit of background as well as some key findings and results, focused mainly on these 2 front-of-package programs, but then I'm going to go into more about some of the other food and nutrition commitments that Walmart has made that some of you may not know about. And I think, first of all, where this starts is I'm a registered dietitian, so I've had the opportunity to be a clinical dietitian and working with individual patients and clients and providing education and seeing the struggles they have to make changes in their diets and in being physically active. Over 10 or 20 years ago, it was so difficult to do that. And now, with all the work that you've heard about today and is continuing to be done, there's a lot more in the environment, a lot more levers and a lot more nudging that's happening to help consumers to make better choices. And I think that's the reason why I have felt so privileged to be involved in these initiatives, because they tend to reach really more consumers. And we heard from them through Hannaford's research as well as Walmart's research. And as you know, Walmart's research is mainly with moms and many low-income moms who are eligible for SNAP and WIC, that they are really pressed for time. We've heard today about all the constraints. But we also know that they want to hear positive messages, and they want the opportunity to make the healthiest choices possible for their families. And they don't have a lot of time. I think the average shopper spends about 19 minutes in the supermarket, which isn't a lot of time. So again, I'm going to highlight these FOP programs. Guiding Stars was implemented in 2006, and then Great For You was implemented about 6 years earlier in 2012. And these are visible in the supermarket, so they are the visible nudge. The nutrition underpinnings for both are the same, although they're applied a little bit differently. They're based on the authoritative science for nutrition and nutrition labeling. And so the Guiding Stars approach is a nutrient density approach. It's a product score based on nutrients to encourage, as well as nutrients to limit. And if those nutrients to encourage outweigh the nutrients to limit, then there's a tiered 1, 2, or 3 star approach that happens in the supermarket. And then just overall by category, you can see how that's applied. More fruits and vegetables, and this is based on dietary guidelines. We're going to see more stars on fruits and vegetables, on whole grains, on low-fat and fat-free dairy products and the like. And then about a quarter of all the foods, all the edible foods in the supermarket do receive the stars. And this is one of my favorite images of guiding stars because it's what it looks like in the supermarket. And Hannaford is one of the supermarkets that started the guiding stars, but then it went on to become a licensing company, and it's in other settings, so it's not just in supermarkets anymore. I don't want to oversimplify it, but I know in the interest of time, I really am talking mainly about what's happening in the supermarket. Now, I live in Maine, so I live in the Northeast, and I get to use Hannaford's guiding stars, as well as Walmart's Great For You. I have to say that, of course. But I want to know if any of you have seen guiding stars. Has anyone seen it in the supermarket? Okay, a few of you, great. Now, it's funny because my partner Mike says, just so you know, he knew I was coming here to talk today. He said, I don't really use it. And I said, well, you don't need to because you have me. But that just speaks to, I think, the demographic and the idea of that choice. It's there, it's kind of understated. If you want to use it, you know about it, then you can. But it's really not in your face, it's not forced on you. The other reason I really like this image is because Guiding Stars, as it should be as a FOP program, is really blind to brand and price and manufacturer. Here you're seeing a frozen product that can be stored more lengthy versus maybe a fresh product. Of course, we want folks to be using fresh fruits and vegetables, but we know that frozen is a great alternative as well as canned that meet nutrition criteria. Now, this is really talking about what happened with the implementation of Guiding Stars, of percentage of total movement in the center store by star value and by year. So we were really fortunate to have sales data to be able to look at pre-Guiding Stars, which was pre-2006, and then see some changes. What we saw, if you can see in the table on the right, the most significant change was for one-starred items at 0.83%, and that was the change between year one and pre-Guiding Stars. And I think that kind of speaks to behavior change theory a little bit, where it's easier to go from, say, a zero-starred item to a one-starred item. So, for example, if you're drinking that whole milk, and Allison talked a little bit about the difficulty with milk earlier, it's probably easier to go from whole milk to 2% milk than it is to go from whole milk and jump to a skim or a 1% milk. And then again, it's great to talk about percentage of unit movement, but what does it really mean from a nutrition standpoint? What do the stars really represent? And we have our cereal story that we like to tell. And so you can see here, as the star values go up, the mean total sugars go down, and the mean dietary fiber also goes up. So what's the impact from ready-to-eat cereals? And here, what you can see is that we were able to measure movement of cereals with stars and without stars. So we put all the stars together and had the 0 stars. And again, just so you know, there's no 0-star icon in the supermarket. Consumers don't want to see negative images. They didn't want to see a skull and crossbones on the 0-starred items. We showed them that. They said, no, thank you. But it does show you here that there was an impact where consumers were choosing the starred items, and the total amount of added sugars sold minus the amount of no stars not sold was that we had a net effect of less than 60,000 grams of sugar in the supermarket that we think was going into carts, obviously, because it's sales, and then going home. And then we also saw that with dietary fiber, we had sort of a net increase of close to 20,000 grams of dietary fiber, hopefully getting into homes and then hopefully getting consumed. And we had some other independent studies by colleagues at ERS and other areas that were able to show the same effect from the studies that we had done. So this was excellent to have these independent validation studies. And there you see some more shelf talkers in the store. And then we know from policy research on front-of-pack labeling, as I mentioned earlier, we had Tracy Fox on the Scientific Advisory Panel for Guiding Stars, and she left us because I guess the IOM made her a better offer, and she was able to participate on their committee that produced this report that shows us that front-of-pack labeling can be an important nudge for consumers. And here's some more studies on front-of-pack labeling that, again, are showing us that as a visible nudge in the supermarket, it's working. Now, I'd like to take a couple of minutes just to go over some of the other Walmart's healthier food commitments. Earlier today, the reformulation commitment was mentioned, and what Walmart did was in 2011, they said, we want to partner with the First Lady with the Let's Move initiative. We recognize how important it is to our consumers to have the option to make healthier choices, but they wanted to really use their size and scope to help address that effort. So they said that they would work with manufacturers and suppliers to reduce sodium, added sugars, and to eliminate partially hydrogenated oils. They wanted to work in their supply chain and their distribution and work with local farmers to see if they could reduce prices, specifically on produce, but also on price premiums of healthier, better-for-you items as compared to the regular item, to save customers $1 billion a year. And they also were very interested in the issue of access, because we know if people have better access to healthier foods, that can help improve their diets. So they looked at their real estate plans and see where they could build stores in food deserts. And some of those are smaller format stores called neighborhood markets. And then they wanted to develop that icon, which they went ahead and did, the Great For You. And then they've also worked to provide charitable support to nutrition education programs. So here's the front of package icon, Great For You. I wonder if anyone has seen this in the supermarket. It's just been out. Has anyone seen it? A few folks. Something to take a look at. Again, we know consumers are very interested in making healthier choices, but don't take a lot of time to read all those labels in the supermarket. And then to earn the Great For You icon, again, it's based on science and the dietary guidelines. A food group to encourage is language specifically from the dietary guidelines. And this image, I think, is important to note because this is what it looks like in the supermarket. It's a small icon on a product that you can see. And then in the produce section, because there is no label on produce, or a nutrition facts label, I should say, there are shelf tags with some prompts for what the benefits are of the produce. And about a third of, or less than a third, of the private label Walmart brand, which is Great Value and Market Side, do qualify for the Great For You icon. And although it rolled out in produce beginning in 2012, it was fully rolled out in produce sections in Walmart in 2013, continues to be rolled out on front of pack on the private label brand, and is now available to national brands. The other thing to talk about is that Great For You does support WIC. We know how important WIC purchases are and having those foods available to WIC families. And then we've been talking a lot about those visible nudges that the consumer can see in the supermarket, but there are also some nudges that maybe aren't as visible, and I think those are important to consider as well. In particular, I think reformulation. As a dietitian, I don't have to nudge the consumer to do anything differently. Food has somewhat less sodium or added sugars or less partially hydrogenated oils, and the consumer goes to choose their favorite bread or their favorite ketchup or some other product, and over the whole basket that they choose, there's going to be somewhat less sodium or somewhat less added sugars or trans fats in their foods. And I think that's an important goal for suppliers to reach. Then Hannaford's also been able to save over $3.5 billion on fresh produce and bring down the differences in prices between the healthier for you items. Say, for example, a reduced fat peanut butter over a regular peanut butter, a reduced fat lunch meat, a reduced sodium lunch meat or a low sodium lunch meat over a regular lunch meat, or a whole wheat pasta and a regular pasta. So if I'm the consumer and I'm standing in the supermarket and the better for you item is more expensive, prices are very important to me, so I may not choose it. If those prices are the same, then, and I don't choose the healthier item, then maybe what's pushing my choices there is taste. So we need to look at pricing. Obviously, taste is still considered very important. And then the access, 224 stores have been opened across the country in areas serving food deserts. We've been able, through the Walmart company and the Walmart Foundation, $41 million in grants have been provided to organizations such as Share Our Strength, Cooking Matters, who we heard from earlier, in their nutrition education. And again, that's visible to the consumer as somebody who can participate in that nutrition education, go into the supermarket, have store tours, and learn about how to make healthier choices while they're there. And then, as you heard, I talked a little bit about the Great For You front of pack icon. Thank you.
Well, good afternoon. It is good to see so many of you still here. I'm Elizabeth Pavanka. I'm president of the Produce for Better Health Foundation. The nice thing, I suppose, about going towards the end of the day is that you can start thinking about what everybody else is saying and you can add them to your presentation. And then you can also think about, oh, gee, I could probably skip over that because somebody else has covered it. So I'll try to do a little bit of that as we go along. I will say that I really appreciated the question from the back of the room after the last panel, because this whole, I was starting to get confused here today about, is this nudging, is it marketing, is it nutrition education, is it communications promotion, and I'm still a little bit confused by all of that, because some of what we're doing, I think, has been considered nudging, but we considered it marketing all of these years. So, so just a little bit about who we are. Produce for Better Health Foundation started back in 1991. You heard about 5 a Day a little while ago. We're the organization that helped take the 5 a Day program national after it finished, after 4 years, it was a pilot program in California. We helped take the program national. We then, when the dietary guidelines changed in 2005, we upped, the number went up to as many as 13 servings a day. We were already freaking people out with 9 servings a day. So we thought we'd test our messaging a bit more, and we changed our messaging campaign to Fruits and Veggies More Matters, and I'll talk about that in a little bit. But just one slide on what we do, and what we've done has evolved over all of these years. At the top here, you'll see we do a lot of consumer research, basically insights that we try to provide back to the industry on understanding consumers. Social media now is a big way that we try to reach out to consumers. It used to be when we first started 20 years ago, we just didn't have the resources to reach out to consumers, so we mostly work through health professionals, and that's why you see that box at the bottom, working through those influencers, health professionals. We also work through the industry. And when I say industry, I mean fruit and vegetable growers, shippers, processors, retailers, even food service operators, anybody along the supply chain, including seed companies, anybody along the supply chain who is involved in fruits and vegetables. So we have about 400 donors, is what we call them. We're funded by voluntary contributions from that industry. But we work through the industry to try to get our messaging to consumers on pack or in store largely. And then, of course, the website, we like to call it the portal for fruits and vegetables. Lots of great new information on our website, and it integrates back and forth with our social media as we try to reach consumers and send them back to the website for information and tips and ideas. I was asked to talk about some of the challenges and opportunities in marketing fruits and vegetables, so I was also glad to hear in our last panel about some of the other factors that we haven't really talked about, but some of these came up. These are all factors that influence fruit and vegetable consumption in particular. These are things that we've watched over the years. I won't go into a lot of these. I will say that I haven't forgotten that one grower many, many years ago said to me, he said, you know, Elizabeth, if we could just tell kids that they couldn't have vegetables until they were 18, you know how many of them would be eating vegetables as kids? So I thought, you know, that goes along with the whole social norm. That's something that needs to be tested. Wouldn't that be fun to test? It's always been that you eat your vegetables and it's a punishment, but But anyway, these are, I won't go into all of them. I will address the marketing just briefly, mostly because I get the question all the time, why does the fruit and vegetable industry not promote fruits and vegetables the way the dairy industry does with the National Checkoff Program? And I'll just briefly tell you that we've tried having that conversation with the industry more than once, very rigorously a few years ago, and the bottom line is that they don't believe that it will work, even though we think there's research, and we've shared that with them. They don't believe that it will work across all commodities. They do believe it will work with individual commodities. So you'll find that there are individual promotion boards, so the Strawberry Commission, the California Table Grape Commission, the National Watermelon Promotion Board, and so forth. So we are that for the fruit and vegetable industry, for all fruits and vegetables, but it's voluntary contributions. Our budget is around, what is our budget? Around close to, not quite $3 million, $2.5, $3 million. So I also wanted to share with you, when I mentioned that we do some consumer research, we just actually published this last month. We haven't even publicized it yet, but it is on our website. You can go to pvhfoundation.org. It's under an About section, and then you go. It's kind of varied, so if you can't find it, let me know, and I can point you to it. But this report, just released a few weeks ago, is called Mom's Attitudes and Beliefs Related to Fruit and Vegetable Consumption, and it's from 2007 through 2014. And so every year we've been surveying about anywhere between 300 and 1,000 moms every year on their attitudes and thoughts about fruits and vegetables. It's a different group of people every year, so take it for what it is, but it is interesting to see what they think. Generally, over time, we're seeing they all have still a very positive attitude about fruits and vegetables. Moms know that fruits and vegetables are good for them. We are seeing a decline in their impressions of canned. It's amazing how terrible they think canned fruits and vegetables are for them. We've just heard about the guiding stars, and I think guiding stars are more complementary to frozen and canned, but we have been in discussions back and forth with NuVal because their 0 to 100 point system isn't as positive to canned, in particular canned fruits and vegetables. In fact, just as an example, it used to be that canned peaches and light syrup scored worse than brownies. And NuVal reminds me that you're not supposed to compare across categories, but we don't think consumers understand that. And in the work we do with the supermarket dietitians, they tell us these scoring systems are very helpful to consumers, and they all tell me, well, we tell them that frozen and canned are just fine, Elizabeth. And to NuVal's credit, they are updating their numbers, and the numbers for canned vegetables and fruit have gone up. With some gyrations that they have done. My biggest concern is that they haven't given credit to those products for containing a full serving of fruit or vegetable because their algorithm doesn't include many of the phytochemicals and other things that are beneficial in fruits and vegetables. They just get dinged for any slightest bit of added sugar. But that's just an aside, since I can add all these little pieces after what I've heard. Moms are saying that eating fruits and vegetables are more of a chore over time. And you can also see a big negative impact on their consumption in the year 2009, 10, and 11. And interestingly, I'll show you a slide here in a minute, the most successful approaches that moms said has worked in getting her family to eat fruits and vegetables have not been tried, but by half of all of the moms. So just to give you, I pulled a couple of nuggets out of the report, if you can see this from the back. We asked moms this question: please indicate your level of agreement in relation to how difficult each is for you personally to include fruits and vegetables in meals and snacks. And the one that I haven't heard this yet today, and this is that different family preferences are one of the things that are one of the most difficult things that they have to contend with. And there's another category that they could respond to, but we had all of these responses based on things we've heard over the years. And I remember in a focus group, one mom said, look, I feed the lowest common denominator, and how many of you do that too? I'm not going to be a short order cook and put everything on the table. I feed the lowest common denominator. So that was one of the top perceived barriers, is that everybody has different preferences. need new preparation ideas. 50% believe fruit's too expensive, 40% believe vegetables are too expensive. And we do not oversample for low income, but it is nationally representative of the population in terms of income. What is nice to see is at the bottom of the slide, you can see only 4% said fruit is not appetizing, and only 16% said vegetables were not appetizing, which is better than I thought it would be. And here's the one about where we asked moms, which of the following approaches have you tried to encourage your family to eat more fruits and vegetables? And then that's the column on the right. Have you tried it? If they have tried it, we asked them for each of the following approaches that you have tried, how successful have they been? And that's the middle column. And I ordered these in terms of what they found most successful. And setting out a fruit bowl, basically having them readily available, was the number one thing that they could do that was most successful. Yet only 55% had tried that. Involving children in growing them, in selecting and preparing them. And then we had added in 2012, we added this question about tangible rewards, because you guys were doing so much great work on the incentive work. And only 8% of moms had tried that, but 52% of them said that they thought it was a successful approach for them. So just a few nuggets from that report. You can go online. It's available to anybody. So in terms of opportunities, I think if you remember nothing from what I say today, this I think is probably the most important slide. Every 5 years we purchase data from the NPD group. They track 2,000 families and 2-week diaries in their homes. And basically, most of the fruits and vegetables people eat, they get from in-home. And that's primarily grocery stores. I was surprised when I first saw this, because only 3% of the fruit people eat, they get from restaurants, and only 15% of the vegetables they eat, they get from restaurants. The yellow at the top is all other away from home, so that's what they might get at school or at workplace. So if you learn nothing else, the supermarkets are very important in how we can reach folks with fruits and vegetables. And there's a huge opportunity in restaurants. That's another way of looking at it. We asked this question in our mom survey: what would be your response to the following communication methods regarding a type of food that you or someone in your household may enjoy? And then we had a whole series of questions, and then an opportunity to just completely ignore it. And through our gyrations, this is basically, and this isn't everything, I just pulled some of them out, but the two on the bottom, note the two on the bottom: supermarket flyer and newspaper ads, and the sign on the supermarket display. So these are the things that they said would be most helpful to them in making a food decision. So that point of purchase is very important, or those ads in the paper. And this is where I was going to talk just for a few minutes on, how am I doing on time? Okay, on the More Matters campaign. I mentioned that we went back and tested this with consumers. We tested it with moms. It actually tested quite well with moms and dads. And basically what we were trying to do was move a little bit away from a factual message, more to an emotional connection with consumers. So it's basically a brand, and we have a whole brand identity around it, and how we talk to consumers. And basically we're trying to help moms who already know that they should be feeding their family fruits and vegetables. We're trying to help her do her job as a mom, to give her the tools. And we didn't want to be preachy. We didn't want to scare her into eating fruits and vegetables. We didn't want to make her feel guilty. We wanted to help her do her job. What we have found, you won't see it in this newest report, but we have noticed in the past that the lower income actually respond better to it, because I think sometimes people don't understand really just how good fruits and vegetables are for them. And that research has just continued to grow. Maybe it's weaker for cancer now than it was 20 years ago, but that research just continues to grow. And I really don't think the lower income know just how good fruits and vegetables are for them. We try to get it on front of pack as much as possible. It's not always there. This is an ad that Save Mart did. Some of the supermarkets have done a very nice job of combining the half your plate message with the More Matters message, and we've very much encouraged that. And we've gotten, when people ask how much they should have, even back in 2007 when we launched More Matters, we would tell them half your plate should be fruits and vegetables, or half of what you eat. So that just ties very nicely with our messaging. We have the logo on about 2,400 Skews in the store. We try to get it on front of pack as much as possible, but it's not always on front of pack. You'll see it a lot on the plastic bags in the produce department. We did ask moms in our survey, how does seeing the More Matters logo affect your decision to purchase the product, and that number has continued to grow over time. 39% when we first asked that question in 2009, and it was 56% here in 2014. So at least they tell us. Now, we don't have actual sales data to prove it, but at least they tell us this. So given that so many fruits and vegetables are purchased from stores, and given that there aren't a lot of marketing dollars for fruits and vegetables, and given that we've worked with health professionals for a long time and consumers trust health professionals, we have spent quite a bit of our time focused on those supermarket dietitians, and in fact just launched a new grant program where we're training dietetic interns to do supermarket tours. And part of that is not only to train the interns, but to try to link up the supermarkets with their nutrition programs nationwide. I won't go into our social media, just know that we spend a lot of time on that. I will say that about 2 years ago, Joe Price and Jason Reese worked with us to put together this particular behavioral economics and the psychology of fruit and vegetable consumption. It was a scientific overview. And it was really a nice literature review and some ideas and suggestions, basically a toolkit of what marketers could do to help increase fruit and vegetable consumption, basically looking at what others have done in the world of finance, and how can we apply some of those learnings to food. So I would encourage you to take a look at that. A couple of the ideas that you've heard about are the rewards for kids, the healthy checkout, home delivery, somebody mentioned that earlier, and pre-ordering. That's becoming more and more popular, and a good place, I think, to do some nudging. Interestingly, for vice goods, discounts work. So for things that aren't so good for you, discounts work for, say, cigarettes or something. But for virtue goods like fruits and vegetables, bonus packs work better. So it'd be great to do some research on that to see if that plays out. Now, supermarkets, this is another thing. Supermarkets may know the answer to all these already. So if you're ever working with supermarkets, make sure you talk to them about this. For example, we know sampling fruits and vegetables work. They know that. It's common practice, but it's not in the literature anywhere. So just some of these things that retailers already know or grocers already know, make sure if you're working with them that you talk to them beforehand. I was asked to mention that you may have heard about the new PMA Sesame Street initiative that was just launched last fall. About 15 folks have signed up for that. Sesame Street's giving that for free to fresh produce companies to use on packaging. So I wanted to mention that to you. And the only other thing I will mention is that we just this month launched a very small, tiny little grant program for fruit and vegetable marketing. If you're interested in that, give me your card and I can share that with you after we're done. With that, I'll end. Thanks.